So we have the pleasure of having Tammy. Sorry, I wasn't prepared. Tammy Curry. She's She's a nurse and goes all over the area and discusses mental health and does mental health education. And we are just now starting a partnership with them and hopefully she'll become more acquainted with Springmore, and we can have more opportunities to provide education for staff as well as for residents. So this is a great service that is provided, and we're looking forward to a good relationship.
Absolutely. Good afternoon, everybody. I'm happy to be here today. And as she mentioned, I'm Tammy Curry, and I'm with a company called VIA Health. And we contract with North Carolina Department of Mental Health and provide educational opportunities in the community. Specifically, our team, it's related to mental health and aging. We're all aging, right? We're all getting older, and it's about how things happen in our life that can affect our mental health as we age. So I'm going to start a little bit with our presentation. I do want to let you know we've had a tiny bit of technical issues, so something strange may pop up there on the screen. If it does, I'm just going to remove it, and we'll move on with that. I like questions, so if anybody has questions or concerns, please feel free to stop me and ask. It's perfectly okay. I'm required to put this disclaimer up here on the screen. I won't read every word of it to you, but we are required to show you that. Basically, what that is saying is that we are not diagnosing anybody here today. We're not telling you what to do. We do want to direct you in a good path, so if you have questions, you can ask. But we are not here to substitute for any medical information that's provided to you by your mental health provider or your physician. So always be sure that you check that out with them. Occasionally, we will talk about a topic that can be triggering or upsetting for someone. If that happens, please take care of yourself. You can feel free to step out, but we do like for you to come back if you're feeling up to it and that you're okay. I think today will probably be okay because we're just doing an overview of mental health. There we go. Got to figure out how all this equipment works together. We do take it at VIA, we take a couple of things into consideration anytime we do a presentation or we're providing care to anybody, because our agency also provides mental health care through other departments. And these are our foundational topics or concepts that we keep in mind anytime we're doing a training. And I'm going to go through them very briefly. If we're invited back and we do other trainings, we'll talk about a lot of this stuff a little bit more in depth. The first is stigma. And stigma is a disgrace or a shame that attaches to someone because of a way other people view some aspect, quality, or circumstances associated with that person. And we know that over time there have been a lot of stigmas associated with mental health and mental health treatment. And part of the reason our team comes out and talks to everybody is we want people to be comfortable getting mental health care if you need it. If I fall up here today and I break my leg, all of y'all are going to expect me to go to the hospital and see an orthopedist or whatever the recommendation is. But if I have mental health concerns or mental health issues, not everybody's going to understand that and may not understand that I need treatment to take care of my mental health just like I do my broken leg. So that is something we want to normalize and take away stigma. We also look at trauma-informed care, and it's care that is sensitive and responsive to the needs of people who've been affected by trauma. All of us in our lives we've lived a long time. I don't know who the youngest person is in this room, and I'm certainly not going to ask because I know it's probably not me. But as we age, we have events that happen in our lives, and some events for some people may be traumatic. And we need to remember that when we're talking about traumatic events, even if it happens to you when you're small, if you are a little girl or a little boy, it can affect you throughout your life. Even when you're in your 80s or 90s. It can still be there. Something I like for us to think about is we all know that the hurricane just happened in western North Carolina. Y'all may know somebody that lives there. That's where my home office is. I don't work there, but Via, that's where they're out of. And we had a lot of people that were affected by that hurricane for months. As a matter of fact, my very first day working with Via was the Monday after the hurricane. So I had to be really flexible. But just think about little children there that have been affected by that hurricane. Maybe their house was destroyed or they lost belongings. Some of them may have lost friends or family members. And that can be a traumatic experience. And that could come back in these little boys' and little girls' lives when they're our age. They may do okay during the interim, but it may come back as they get older and as they age. So that's one of the things that we look at. And the last one that we look at is person-centeredness, and that's a set of values and tools based on the idea that all human beings are of absolute value and worthy of respect. And basically with that, when we're getting treatment anywhere or we're talking about things, we want treatment that we want. And what I want for treatment might be very different than what you want for treatment, right? And we want people to get and receive the treatment that they desire in a way that they desire it. So if we have an opportunity to talk with workers and employees who work here, we're going to talk about these same values and hope that they look at them as they're doing their jobs and how it may impact you over time. Our objectives today are to understand the impact of living with mental illness, identifying the most common mental illnesses in older adults, and recognizing common strategies for caring for mental illness. So we're going to start with this phrase: what is mental health? I hear y'all have had a couple of speakers about mental health this month. So can somebody throw something out to me of what mental health means to you, or what you think about when you hear that phrase, mental health? Feeling okay with yourself. Okay, I like that one. Anybody else? What do you think of when you hear mental health?
Being able to deal with things as they come.
Being able to deal with things as they come. Okay, I like these two answers. These are two really good answers. Y'all, I teach this a lot to employees at places like this and other places in the community. And when I ask this question, I usually get very, very different answers. Those are the answers that I want. But I usually get answers like depression or seeing or hearing things or other things like that, which are actually mental illnesses. The things that they said are mentally healthy, because we want to be able to cope with life as it happens, right? And that can be very, very different for different people. So mental health includes our emotions, our psychological status, socially, spiritually, well-being. So it includes the well-being of all of those different domains. So we have to keep that in mind. It helps us make good choices. It helps us when we're living our lives to live in a way that we want to live. Okay? So we look at this, mental illnesses versus mental health. When we're mentally healthy, we have a positive attitude. We're resilient. What does resiliency mean? Bounce back, the ability to bounce back, resilience. I don't know about y'all, but as I've been doing things and as I've gotten older, I have learned that some things may get a little bit harder the older I get. Okay? I don't hop out of bed quite as quickly as I did in the past or things like that, or I may have a little bit more trouble, or it may take me a little bit longer to learn to use a new piece of technology or something like that. But did you know that resilience is the one thing that we do better than younger people? Older folks, as we age, our resiliency and our ability to bounce back gets better. So we have that over younger people. So we have the ability to do that, and we're really, really good at it. So we are able to make good decisions and good choices. Our being mentally healthy is influenced by things like our environment, where we live, our physical status, the people that are around us, and how we feel in general. And the perception of mental health, if it's negative, which it doesn't sound like y'all have that here, can make stigma worse. But we want to learn to change our focus from mental illness to mental health and recovery, resilience, and hope. So we want to look at things that we can do that will improve all of that for us. Now, I like this here. We see that ball kind of there in the middle. It says stress, okay? And we see a person over here who's mentally healthy. And we see a person over here who has mental illness, okay? Charlotte, can I get you to volunteer just for a second to come up here? Can I get you to volunteer too? Okay. Carrie. Sorry I didn't get your name earlier. She's got cute earrings though, y'all. One of you stand on the mental health side and one of you stand in front of where it says mental illness. Okay. What's the same about them when we look at them? What's the same? Beautiful women. I like that. Right answer. He's giving good answers today. Okay. What else is similar about them? They're both women. Anything else? You see the stress in the minute? We're going to talk about that.
You can't tell whether they're standing in the right place.
You can't tell whether they're standing in the right places, and we don't know what happened with them and what may have come up. Is that what you were talking about with the stress and how that stress may affect them? Okay. Carrie over here got up today, and she had a great morning. We hope that she has a puppy dog that gave her kisses this morning, a cat. Hopefully the cat was nice this morning, and she had breakfast. She had her favorite breakfast this morning. Got children. They all behaved, and they got ready, and they did what they were supposed to do in school. It's coming to the end of the year, and they all made straight A's. Okay? So where do we think her stress level's at? Pretty low. So we think she would be more likely to be over here on the mentally healthy side. Okay, and we're going to come over here to Charlotte. Okay? Charlotte got up this morning and realized her alarm clock didn't go off. And she has overslept by 45 minutes. Do you drink coffee? Okay. She grabbed a cup of coffee as she went out the door, but as she was backing out of the driveway, she spilt that cup of coffee all down her shirt. And she didn't have anything to eat, and it's raining, and she forgot her umbrella. She couldn't find it. Okay. As she was driving down the interstate, she hit something in the road, and her tire went flat. What's happening to your stress level?
It's not going really well.
Mm-hmm. And I know from talking with her earlier that she does have kids. And she got a call from the school. One of her children has a fever. And she's supposed to go pick them up. And they can't stay there all day. And it's exam week, so they're going to have to figure out how to make up that exam. So where is her stress level at? Is it up there? Okay. So it's different. And those stressors and things can affect how we are and where we're on this. Is it possible for things to happen in each of their lives where they may move up and down this continuum? Okay. Because we can move and we can go up and down the continuum. Okay. Let's say that when she got to work today, Carrie knew that she had had a hard time. A police officer stopped and fixed her tire, by the way, and she called in to let them know what was going on. And she told Carrie she had not had breakfast and she had spilt her coffee on her. And when she got here, Carrie had got her a cup of coffee and had her whatever her favorite breakfast is, and her best friend has picked her kid up from school, and the child's doing better. She took some Tylenol. Her temperature is coming down. What's happening to her stress now? Okay, so she's going to move down here a little bit just because that happened. So we need to look at what stressful events can happen and how that can affect our lives over time. Does everybody who has stress in their life develop a mental illness? No. Okay, so we want to remember that. Does stress by itself cause mental illnesses? No. Okay, but it can be a factor that can affect how we respond to it, how we respond to mental illness or being mentally healthy, and it can impact all those things. Thank you, ladies. Yes, let's give them a hand. They did that. They did good. So I appreciate you for helping everybody in the audience. Now, some of the things that we want to remember about mental health in later life is there is hope even when your brain tells you it's not. Oftentimes with mental health and mental illness, people's brains may tell them, you're not ever going to get better. You're not worth that. You're such and such an age, so you should feel that way. And all of those things are false and they're not true. And it can affect people's behavior and how they respond later in lives. Our thoughts, feelings, and behaviors can affect our mental health. It can cause physical and emotional suffering. But one thing that we want to remember is that it's treatable. Most mental illnesses are very treatable. So it's important to get the person to treatment. And another thing we need to remember is it's everybody's responsibility. You may have a neighbor that may not be feeling really good, but you could check on them. And if too many days go by and they still seem to not be doing well, it might be a good idea to tell a staff person, can you go check on Mary Sue? I'm really kind of worried about how she's doing. Now we're going to talk a little bit about the most common mental illnesses in the aging population. And I want to tell y'all, we're going through this pretty quickly, but I want to remind you that every one of the illnesses that I'm going to show you up here, we have a more in-depth course that we can talk about it further. We also have a fun course that's called Complementary Treatments for Mental Health, and that one's fun. We can do that sometimes too. But here we go. We're looking at these, okay? Depression, dementia, suicide, delirium, anxiety, and substance use. Which one up here do we think is the most common mental health disorder, not just with older adults, but with everybody? Anxiety, exactly right. And it very often co-occurs or it happens with other illnesses, other mental illnesses and other physical illnesses. So it's very common that you may have anxiety if you have another physical illness. One that I can think of kind of off the top of my head is, what if somebody has asthma and they're having an asthma attack? Do you think they get really anxious? Okay, why are they getting anxious? They can't breathe. They're not getting enough oxygen. We're all going to become very, very anxious. A disease like diabetes. Why would somebody with diabetes get anxious? Blood sugar drops can make somebody very, very anxious, definitely, from being too high or too low. Another way that it could cause anxiety is, I've got to go see my doctor today, and he's going to check my blood sugar. He's going to check my A1C, and he's going to know what's going on. Okay? So it can co-occur and it can happen with other illnesses. I want to mention a little bit about depression. Did you know that if you go to your doctor's office and you're sitting in your doctor's office and there's a total of 10 people in that doctor's office lobby waiting to be seen, statistically 1 out of those 10 people will have depression? Okay, how many of us are in here today? 10? Okay, so statistically, 1 of us. What if we go to some place that's got a lot of people in it? What's the place around Raleigh that holds a lot of people? The arena. We're going to go see the Hurricanes play tonight. Let's go see the Hurricanes tonight. And if we counted off every 10 people in there at the Hurricane Stadium and one of them had depression, that could end up being a lot of people, couldn't it? Okay? So it really, really does affect people. Do any of these things up here surprise you when you see them? Of these being the most common, or do you know what all of them are, or do you have any questions about any of them? Delirium. Okay. Delirium, that's a really good question. Delirium can happen at any age. It's more likely to happen as we get older, and it's where a person can quickly develop confusion and disorientation, and it may even look like they have dementia or Alzheimer's disease, but it's actually from a physical cause. It's something physical. So it could be something like somebody's developed a urinary tract infection. They've been doing okay for years and years, and they've got this urinary tract infection, and when Charlotte checked on them yesterday, they were perfectly fine, and she comes in this morning, and they're confused, and they don't know what day it is. They look like, well, goodness, I know she can't develop Alzheimer's overnight. What has happened? What is different? And it may be that infection or that physical problem is causing that confusion and disorientation. So if it happens quick, if somebody goes from being normal and they have that quick change, we need to look at a physical cause. Okay. Delirium sometimes can happen when we age, if somebody has to go into the hospital and maybe stay in ICU or somewhere like that for a long time. It can cause confusion and disorientation too. Any other questions about any of these up here that look different, or that you have questions, or it surprises you to see them up there? What about substance use? Do you think that's a big problem for aging population? Okay. Y'all were sharp. I usually get a no for that people are usually really, really surprised to see that one up there. Okay. What substance are people most likely to overuse? Alcohol. Yay. Have y'all talked about that this month? Nope. Woo, y'all got some smart folks in here. Alcohol, absolutely. Why are people more likely to use alcohol than street drugs? Easier access. It's legal. Don't want to get in legal trouble, right? Easy access is a big one. A lot of people have that. You know, they have access to alcohol. It's easy to buy. It, depending on what you get, can be relatively inexpensive. So yes, after alcohol, what's the second most common misused substance? Pain medication, prescription medications, or anxiety medications. And I want to remind everyone that sometimes a misuse of a pain medication could start very, very innocently. It could be that somebody had an injury and they were prescribed pain medication. I told y'all I fell up here and I broke my leg, and I go and I've got to have surgery on it, and they put me on some sort of pain medication. It may be for a very legitimate reason, and then the person can develop an addiction to that medication and may misuse it over time. So that one's very, very common. So if y'all have interest in these, I would love to come back and talk with you about any of these. Sometimes people are always a little bit worried about dementia, and I think that's kind of normal for all of us as we age. How many of us in here know somebody that has dementia? Okay. And I think one of the important things that we need to remember when we're talking about dementia is there are things that are risk factors that we can't change, but there are risk factors that we can change when it comes to dementia. We can't change our genes, can we? Nope. Can't change our age. Nope. Can't do that. And we know that age is probably one of the biggest risk factors. But what are some of the things that we can do that can reduce our risk of developing dementia? Any ideas? What things can you do that's healthy for your heart? Walk. Exercise. That's a good one. What else is good for your heart? Eat well, balanced diet. If you smoke, stop smoking. Okay. Getting enough sleep. Watching your weight. We think that things that are healthy for your heart are also very healthy for your brain. So if you're doing things to take care of your heart, very likely you're taking care of your brain health at the same time. So, we may not be able to control our age, but we can do some things that might help us as far as reducing our risks that are modifiable. So keeping that in mind. I don't know about y'all, but even those few things that we mentioned, there's one or two things on there that I could probably do that would reduce my risk. Number one, eating better. Okay? Anybody in here sometimes eat things that you shouldn't eat? Okay. I like M&Ms, y'all. Not good for me. I like them too much. If they're in the house, I'm going to eat them. Some of you may be the same way. I'm just as happy if I eat an orange, but I'm more likely to pick up the M&Ms, so we may see. Exercise, I know that I need to exercise more. We would want you to check in with your physician about what appropriate exercise is for you, but you mentioned walking, and something as simple as walking can be very, very helpful over time. Okay? According to the National Alliance on Mental Illness, we see that 6.5 million Americans over age 65 have symptoms of depression, and many of them go untreated because doctors assume that their depression is a normal part of aging. Depression is not normal at any age, so it's very, very important for us to remember that. And don't just assume because somebody's over 65 that what they're experiencing is normal. It's very likely, I'm going to speak to my staff people that are in here, you may have somebody who's been depressed for 30 years before they got here, and nobody's ever noticed or nobody's ever done anything about it if they have noticed. So you could make this part of their life better by helping them and explaining to them that this is not a normal part of aging and getting them connected to the care that they get. I saw a head nodding somewhere in the room as I was talking about that. So that's really, really important for us to think about. Anxiety. Studies show that generalized anxiety disorder is more common as we age and as we're older. And this is kind of an important slide here. What do we notice? The red one is depression and the blue one is anxiety. What do we notice? They overlap. A lot of the symptoms are the very, very same thing. Excessive worrying, restless, irritable. Y'all, and sometimes depression can show up as irritability and agitation. When we think about depression, a lot of times we think about the sadness and the crying and the loss of interest in activities, but we do know that it can show up as things like tiredness, thoughts of death or suicide, irritability. I know we've got a couple of gentlemen in the room, and I don't want to make overgeneralizations, but we do know that men are more likely to present with agitation or irritability with depression in many instances, and it's because they have not been allowed to talk about their feelings as much, and they're more likely to stuff their feelings down inside. So that's something that's important for us to remember. We also want to remember that if somebody is having thoughts of harming themselves or harming someone else, that is a medical emergency, and you need to take that very, very seriously, and it can happen at any age, but particularly with older adults. We talked a little bit about substance use, and you guys were right. 3 million Americans age 55 and older misuse alcohol. Something important to remember about alcohol, as we age, guess what? We're not just aging on the outside, we're aging on the inside. We notice these changes that happen on the outside, don't we? Do we see those things? We may see there's a wrinkle or your hair's turning gray. Or the one I notice is I have long sleeves on today. Any ladies in here notice that when you wave, your arm kind of does weird stuff there too, and I'm not real sure where that came from. But you're aging on the inside just like you're aging on the outside, and your body may not be able to tolerate the same amount of alcohol that you were able to tolerate 30 years ago. And even for women, the standard size of one drink, one glass of wine, one beer, or whatever, is more than the recommended amount of alcohol for an older lady. How many of us knew that? So we may not be able to tolerate that. Maybe you mowed grass and you had you a couple of beers when you were younger after you mowed grass, and or you went fishing with your boys or your friends or whoever, and you had a couple of beers, and you may not be able to tolerate the same number that you did before. Something that we think is going to happen, and in some incidences and in some places in our country, people, as they're aging, are starting to use some recreational drugs that they used when they were younger. Probably the most common one of that is marijuana. And we also need to remember that our body is changing, and we may not be able to process and clear that out at the same rates. And we also need to remember that marijuana from the 60s is very different than the marijuana we have today. So very, very different, much more potent, and some people are getting into some trouble with that, and they're having problems related to that. And oftentimes I have people tell me, well, folks live in an independent living apartment complex for older adults, or they live in a family care home, or they do something like that, so they don't have access to street drugs and things like that. Guess what? They do. They have access, right? Okay? So it's very, very possible. It's even possible for people to go out on leave with family members or drive yourself somewhere and be exposed to different things or make choices about different things. You could go out for an evening out, have a glass of wine or something like that. Just remember that it may affect your body differently now than it did in the past. We talked a little bit about dementia. Okay. These are a little bit of information about the four most common types of dementia. How many types of dementia are there? Y'all know there are at least 5 because I have 5 little blue blocks up there. How many types do we think there are? 20. I heard of 20. Anybody else? There's over 150 different types of dementia. Can I name all of them? No, I can't. I can probably name more than the average person can, but there's over 150. Alzheimer's accounts for 50 to 70%. Lewy body dementia, 15. How many people in here have heard of Lewy body dementia? Okay. Y'all are informed. This is an informed group. What famous people do we know who had Lewy body dementia? Robin Williams is the big one. Y'all know how I know I'm getting older? Taught this class not too long ago, and there was a young girl in there about 30. She had no idea who Robin Williams was. That hurts, doesn't it? I do too. I told her she needed to go look him up and figure out who he is. Okay, Robin Williams is one. Who in here knows who Casey Kasem is? Okay, Casey Kasem also had Lewy body, and for those of you that don't know, he did the countdown. Top 40 countdown. He also was the voice of Scooby-Doo, for those of you that didn't know. He also had Lewy body. With Alzheimer's disease, people like Estelle Getty, the singer. I want to say Buck Owens. It wasn't Buck Owens. It was the other one. Glenn Campbell. That's who it was. Okay, but Lewy bodies we know affects about 15% of people. Vascular dementia is number 3, and that affects about 10% of people. We know that we have high incidence of that in this area. Y'all, my dad had vascular dementia. It wasn't his biggest problem, but that's because of blood flow problems to the brain. We know that it's very closely related to cardiac and vascular disease. And he had heart trouble also. And then we have frontotemporal dementia. Does anybody know a celebrity right now that they're talking a lot about frontotemporal dementia with? Bruce Willis, yes. Another one that we hear about, I don't know, does anybody in here know who Wendy Williams is? They've talked quite a bit about her having that. And then we see other there. And I also want to let you know that there's a lot of dementias that overlap. So it is possible, and in most cases probable, that people have more than one type of dementia at the same time. I'm interested to see what happens. Have any of you heard that Billy Joel had to stop performing? He has something called normal pressure hydrocephalus, And it can cause some memory problems, but that's not always the case. I know he's had some balance problems and some issues with things like that. It can cause some hearing loss. It could potentially be in this also. So it'll be kind of interesting to see what he and his family, but they're working really hard, and from what I'm reading, hoping he kind of recovers from that. So I'm hoping that they're going to be able to get him really treated. But I think he canceled all of his shows. Hello. Okay, we talked a little bit about delirium. And we know that it affects 2.2 million people hospitalized every year. And we know that that can happen, and it's related to a medical illness. Y'all, that happened to my mama last year. It's been just a little bit over a year. My mom is 84 and lives alone. Overall, does really, really well, as many people do of that age living alone. And I got a call from her one day, and that morning she sounded just a little bit off, but nothing I could really put my finger on. She lives in South Carolina. I live here in North Carolina. I got a call from my niece later that day. She had gone in, and my mom was lying in the floor. Not common for Mama to be lying in the floor, but she told us she did that on purpose. I went down the next morning. She went to the urgent care, got put on medications, and sent back home. I went down to visit her the next morning, got there. Her fever was 103. Okay. She had a urinary tract infection, and she spent 4 days in the hospital. And during that time in the hospital, she got confused and disoriented. She was seeing things and hearing things that were not there. She was convinced that the hospital staff were riding my dogs. The big one weighs 13 pounds, y'all. That's the big one. So that can tell you how a simple illness like that can make somebody that confused and that disoriented. She had delirium. She's fine now. They were able to treat her. She came and stayed with me for about 2 weeks. She's back living on her own again. She got where she had trouble walking. They had to have her walk with a walker during that time, but now she's walking independently again. So that's just a quick example of what delirium is and how quickly it can happen and that change can take place. Okay. Suicide in older adults. We know that older adults over age 65 comprise about 30% of the United States population, but we know that they account for about 18% of people who pass away by suicide. These are some of the risk factors associated with that. We have a whole class on this topic, y'all, and it can be a hard topic to talk about, but it's an important topic. And if that's something that everyone's interested in, I would be more than happy to come back and us talk about that again. It is a psychiatric disorder. It's also a medical disorder. And all of these things that are listed there can impact that. And you see the big one in the middle is social. So we know that people's socialization is extremely important, and being social can be important for all mental illnesses and mental health reasons. I also want to remind you that different people have different aptitudes maybe for socialization. Some people have always been a social butterfly. Who's my social butterflies in here? Somebody's got to be a social butterfly. No social butterflies, and they want to do everything, and they want to go to everything and do all that. Charlotte, are you the social butterfly? You're smiling back there. I'm definitely not the social butterfly. For some of us that have never been the social butterfly, we're not going to engage in a whole bunch of socialization. We're not all of a sudden going to start doing that. But if it changes from what our baseline was, that's what we want to look at. If you notice that, that could be an indication that there could be worth investigating to see if someone's having some depression or other problems that may go along with that. Okay. These are some additional disorders that go along with that. PTSD. And I'm not going to go through all those because I want us to have a little bit of time to talk about the end. Schizophrenia. I thought I had blocked all these, but apparently I didn't. Care and treatment. So what can we do if someone is having problems and they're struggling with their mental health? What can be done to help them? Any ideas? Talk about it. Okay? They could talk to their friends and family. They could talk to maybe a religious professional. They could talk to counselors, their nurse, their doctor. People like that can often help or point them in the correct direction. It's most important that we remember that linkage to appropriate care is probably the best thing for people to know. You as a friend, things that you can do is be present. Let them know that you're concerned about them. You know, I'm worried about you. I care about you. I want to help you. We'll walk through this together. Can make those things like that can make a world of difference for different people. Can medications be helpful? Okay. And for some people, they may need a toolbox approach where they need more than just medicines or talk therapy. Maybe they need a lot of different things or several different things to help them get past a rough patch. Somebody's faith could be really important to them if they have a specific things that they do within their religion, prayers, songs, meditation. All can be important. What are some other things that we can do that can help us with our mental health to be mentally healthy? A lot of these things are free. We talked about some of them early. Exercising can be really, really important. Getting out in nature. Today's not the day to get out in nature, but it looks like to me y'all might have some places around here that as it gets warmer that it might be nice to go out and sit for a little while. Do y'all have some opportunities to be able to do that? Do y'all have activities that are done outside where maybe you can get outside for a little while? What's some of your favorites? Walking? Y'all do picnics or cookouts or anything like that?
We have
Croquet twice a month, okay. Anybody play pickleball? I hear about pickleball all the time.
There are groups here.
There are groups here that play pickleball? Okay. Couple of them? Okay. So, you know, things like that can be really important. Do we have anybody in here who's artistic that likes to do art? I got a hand up there. What do you do?
I've done oil painting. I've painted ever since I was 6 years old.
Okay, so something like that could be really, really important as a stress management for you to be able to have access to those tools and do things like that. Do you find it relaxing when you're working on your paintings and things like that? Mm-hmm. Puts you somewhere else. So it takes you out of where you are here and what's all going on, and you can move out and give your brain a rest. Okay? And these other things can do those things too. Thank you for the way that you said that. I like that. Other things that are creative that people can do, some people play musical instruments, crocheting, knitting, quilting could be a good one. What other things can people do? Does anybody in here like to journal? Does anybody write in their journal? Okay, I have two journalers over here. I am not a journaler, y'all. Are you a journaler? Gardener. Oh, I like that one. Do y'all have places around here y'all can garden? Do you have that? What do y'all plant in your garden? Do you see anybody?
Flowers.
Your flowers, you do flowers? Okay. Are they blooming right now? Oh, they're beautiful and they smell good. Oh, yeah. She needs to bring flowers in tomorrow. Don't you think? She needs to bring everybody in here a flower in tomorrow. But things like that can be important. For journaling, for some people, if they've got things on their mind, if they write them down and they can see them out on paper, that can be very, very beneficial for them, helping them look and weigh that back and forth about, you know, is this a good choice or is that a bad choice? Or maybe it's nighttime and I'm trying to go to sleep at night and I'm thinking about what I've got to do tomorrow or what I've got to get at the grocery store and I'm worried about that. Write it down. You know, do that. Do it real quick. Jot it down. And then go back and look at that and think about that. Does anybody in here do anything like deep breathing? Charlotte, have you ever done deep breathing exercises with people?
I did. Just last week was our presentation on meditation.
All right. So how did y'all find that? Was that helpful?
It's very
Very relaxing. Has anybody used that since last week? Has anybody used that deep breathing exercise since last week? Okay. I'm going to tell you something. I had to go to online training where I worked last week, 2 whole days of that. And there was a brief presentation that actually the manager of my department did, and it was on deep breathing exercises. And I know this, I know how to do it, but since I had that little mini refresher course, I've used it several times in the last week that it's kind of helped me when I was getting anxious or worried about something. I had trouble sleeping the other night. I could not sleep. So I used 2 of these things. I had some stuff on my mind that I didn't want to forget, and I knew that next time I went to the store, I needed to buy these things. Does anybody get crazy stuff like that on your mind when you lay down at night? And I went ahead and I got my phone in the Notes app and I typed those things in there that I needed to think about doing. And then after I did that, I did the breathing exercises that we had been reminded of in that training that I went to. And I was able to go to sleep after I did those 2 things together. Watching your diet can be real important. If you have a tendency to be anxious or you have trouble sleeping at night, things like watching what you're eating as it gets closer to bedtime. What kind of things keep you up at night if you eat it? What was that? Caffeine. What's got caffeine in it? Chocolate, my favorite. Coffee, tea, soda. Okay. So thinking about all those things, sugar. Sometimes for some people, certain foods may keep them awake at night. You may not want to eat big old pepperoni pizza before bedtime or something like that. It could potentially keep you up at night. So what other things can you think that could be done to help somebody or something that you could do for yourself if you're concerned about stress that you're having in your life? We're going to talk to somebody. We're going to use lifestyle changes. Prayer is always a good one. Music. Does anybody in here like music? Okay. And our musical taste may be very, very different from person to person, so you have to do what's important and what's good for you. Okay. So what we've learned today, we've talked about the impact of living with mental illness, the most common mental illnesses in older adults, some care treatments and strategies, and that's our references, which I'm going to click through real quick because I want to get to this slide. If you or someone you know needs to connect to mental health services, ViaHealth's number with the counties they cover is on your left, and over here on your right is Alliance Health. And the number that you can contact, since you live here in Wake County, if you need connection to mental health resources and mental health referral. You can contact their number. They're the managed care organization for this area. We actually contract with them to do what I'm doing here in your area. So that's the number that's available to you. It's available to anybody. Also wanted to point this out to you. Hopefully you will never need this, but there is a service called Mobile Crisis Services. And if somebody is having a mental health emergency that normally a person would go to the emergency room for, you can call the crisis management mobile crisis number. They can discuss that with you on the phone. For staff, that could possibly be helpful to you, and make a determination, and they might be able to send somebody to you versus you sending the person somewhere else. So that's something that could be valuable. Therapeutic Alternatives covers for Wake County. And do we have any questions about what we talked about?
I don't have a question really. I just have a comment.
Yes, ma'am.
And that is when you were talking about writing or putting things down when you can't sleep. And in my mind, I think, they're going around on a wheel in a circle. And I think there's so many. And then when I start to write them down, it ends up being maybe 4 or 5 things that I'm thinking about. But because it was just kept going around in my mind, it felt like more like 500 things. And so it really does help me.
That's exactly what happened to me the other night. I was running this list of things through my mind, and when I wrote them down, there were 6 things. That was it. But it was like I had spent, it felt like hours of, oh, I can't forget this. I need to do this. And of all things, it was a list of things that I needed to get together or check on before we go on vacation. And I'm like, well, this is not relaxing. Vacation's supposed to be relaxing. This is not relaxing. So that was the list that I was working on with that. So you validate that sometimes writing that down can make it seem different. And another thing that could do, using that at any point during the time of the day, writing things down that are bothering you. Sometimes when we're thinking about things and it's swirling around in there and going in circles, we sometimes can make mountains out of molehills, and it seems way bigger than what it actually is. And sometimes if we put it down there on paper and we're looking at it, we can see it more clearly and make better choices or decisions once we do that. Any other questions or comments? I hope that you found this helpful, and I hope I get to come back and talk with you all again. Y'all have been a delightful group to have here. I'll be around for a couple of minutes. I think that some of you probably got an evaluation to complete at the end. If you didn't, we have extras, and the top part is filled out for you. If you could just complete the bottom part of it, that would be great. You feel free to say whatever you want to say, because it gives us an opportunity to change things if we need to. But thank you all for coming today.